We've got Dr. Matthew Austin with us today. If you've got a question for him, feel free to call in at 877-897-8255 or 813-636-8255 and 636-8255, and you always win a prize package. Dr. Austin, how are you today?
I'm great. How are you?
Doing great. So you're an orthopedic surgeon, am I correct?
That's correct.
Okay, and so as people get older, how prevalent are hip problems?
Well, hip problems are very prevalent. There are several 100,000 people that get hip replacements every year, and this is added on to the number of patients, over 350,000 who have hip fractures on top of that. So it's a pretty prevalent problem.
And so hip fractures, is that just, why do those typically occur? Are there more prevalent reasons than others?
Sure. The number one reason is as you get older, your bones tend to get a little weaker. It's called osteoporosis. And that combined with the fact that as you get older, you sort of lose your coordination a little bit, your eyesight's not as good, and people tend to fall. So you have a softer bone and you fall, and it increases the risk that you're going to have a fracture when you do fall.
Okay.
Now, certain populations have a higher risk, such as women. They may have a 2 to 3 times higher risk of hip fractures as compared to men. And Caucasian women, postmenopausal women in particular, have a much higher chance of hip fracture.
Really? That's so. Now, sometimes people get a hip fracture before they even fall, right? Because they say, most people think, well, I fell and I got a fracture because I fell. But that's not always the case. I mean, sometimes, like you said, you are falling and you're fracturing. But sometimes things are happening before you fall, right?
And that's absolutely true. And sometimes what happens is people have the fracture, then they fall, and then they're seen in a local emergency room. And it's important for your listeners to know that patients who fall and have a lot of pain after the fall should have an MRI done. They are experiencing significant hip pain, and it looks like there's no fracture, because sometimes there's what's called an occult hip fracture, which is a hip fracture you can't see on plain X-rays. And sometimes it's missed, not because it's anyone's fault. It's just that some people don't think about it.
Well, and, I hate to give emergency rooms a hard time, but I had a doctor once say to me, try to stay out of them as much as humanly possible. I don't know how...
Well, that's hard advice, and they also have a very, very tough job.
Right. And that's why I said I hate to give them a hard time, but, it's probably really important, even if you go to an emergency room, they don't see it, but you're still having pain, to go see an orthopedist. Would you agree to that?
That's absolutely true.
So don't just write it off, well, they said I was okay. I mean, I recall when I had a broken nose when I was about 19, the emergency room doctor looked at me and said, you're perfectly fine. I went to an ENT and he said, give me your driver's license. He looked at my license, he looked at my face, and he said, your nose is broken. So, so you're right. They're very busy. They're very stressed out saving people's lives, and sometimes things do get missed. And you're saying postmenopausal women, they're the ones that really have to, make sure they're doing the right things, because they're the most susceptible to hip fractures.
Yes, I mean, everyone sort of has to pay attention, especially as you get older. Not only could you fall and hurt your hip, but you could hit your head and cause some damage there or injure your neck. So you have to be careful, but you're right. There are certain populations that are more at risk than others.
And some of us are probably doing things long into as we get older that are going to cause us problems, like, tennis players. I've known, more tennis players tend to get hip fractures or get hip replacements than friends of mine that might, just go out there and play golf sometimes.
Sure, although they may be getting replacements because they still want to be active and get out there and do it, and tennis is a little more of a, demanding sport. So you may be seeing a population that's getting hip replacements because they want to stay so active. Okay.
And so are there specific parts of the hip that are more frequently broken than others?
Sure. As you know, the hip is really a ball and socket joint.
Mm-hmm.
So it's really the part below the ball called the neck of the femur, or your thigh bone, that's the most frequently fractured or broken part of the hip.
Is that the part of the hip that's taking the most, work and is doing the most work and taking the most, or what's it, the biggest brunt of the work that the leg does and the hip does?
Well, it's certainly taking the biggest brunt when you fall, because you put a lot of force on that area. You usually fall on that hard bone called the trochanter, which is part of the thigh bone. When you fall right under the trochanter. It puts a tremendous amount of force across that neck of the femur, and that's where it tends to break.
Okay. So what do you advise people? What are the best things to do to avoid a hip fracture?
Prevention, of course, is the best medicine.
Right.
So there are certain tips at home you can do. You want to remove tripping hazards, such as if you have loose rugs in the house, or if you have electrical cords that are strewn about. You want to make sure they're out of the way. If there are grandkids about, you want to make sure their toys are out of the way. You want to make sure that you wear good slip-resistant footwear. You don't want to be walking around with smooth socks. And make sure you have the areas where you're walking well lit. Those are just some of the common sense things you can do. They're very simple and don't cost any significant amount of money to prevent these fractures.
Now, some people might think as I get older, maybe I should take it easy. I shouldn't exercise a lot because I could hurt myself. It's just the opposite, isn't it?
That's true. Bone is a use it or lose it kind of thing. If the less you walk on your legs, the more weak the bones become. So staying active is not just good for your heart and your lungs, but it's good for your bones as well.
Right, and you have to do weight-bearing exercise because some people think, well, if I just go swimming, I'll be perfectly fine, but that's really not that much of a weight-bearing exercise.
It's not. So for your heart and your lungs, swimming is a great exercise, and for those who have joint problems, swimming can be one of the most productive forms of exercise that they do, but you're correct. You don't bear any weight while you're swimming, or you don't bear as much weight when you're swimming, and it doesn't strengthen the bones as much. However, if you're walking to the pool, that can help.
It better be a long walk to the pool, though, right? It can't be just like outside your back door.
Yeah, that's probably not going to do it.
So, and you're with, am I correct, the Rothman Institute?
That's correct. I'm with the Rothman Institute. We're focused mostly in the Philadelphia region and the southern New Jersey region.
Okay, and so once someone's been diagnosed with a hip fracture, does it always need surgery?
It almost always needs surgery. Once the hip fractures, it's usually an unstable type of fracture, meaning it's likely to keep moving. So in order to prevent worse damage, we tend to fix these fractures. Okay. And it actually helps patients mobilize much more quickly.
So when it's fractured, is it just an area that's broken to a certain extent? Like I had a fractured arm once. It was cracked halfway through the bone. Is that what you mean, or is it fractured and it's completely separated?
Well, sometimes it's as you described with your arm. You were lucky with that. But sometimes the fracture goes completely through the bone, and then the bone ends move apart. So that's obviously much more of a significant situation, and it actually goes into how we treat the fracture. So sometimes when the fracture is really widely displaced, it interrupts the blood supply that goes to the bone, and when anything doesn't have a blood supply, it dies. So in those kind of cases, we tend to do a replacement.
Okay.
In cases where the bone ends aren't separated, we can sometimes fix it, which is a little bit of a simpler surgery. So it really depends on the type of fracture that you have.
Right, but either way, you've got to go see an orthopedist and get it taken care of because you should not be living with a fractured hip.
Absolutely not. In most cases, it's pretty much impossible. It's just that painful when you try to put weight on it.
All right. Well, we're going to talk a little bit more to Dr. Austin about, the different types of fixes, rods, plates, screws, all that type of information coming up. I want to remind you can pick up Senior Voice America all over the Bay Area. The May issue is going to be out in the next couple of days. We've got some exciting shows for the rest of this week. I know we've got Dr. Castellano coming on from Image Lift. I think that's tomorrow, right, Deb?
Tomorrow.
So make sure you tune in. If you've got any plastic surgery questions, he is the perfect one to ask. And if you've got any more questions about hip replacement, give us a call at 877-897-8255. All righty, you're listening to Senior Voice America. It's 1250 WHNZ WHNZ. You'll catch us Monday through Friday right here on WHNZ.
An all-inclusive driving experience has arrived at Dick Norris Buick GMC. Experience Buick with an all-new lease on luxury with zero due-it signing on every new Buick. All new Buick Verano, $339 a month. Buick LaCrosse E-Assist, $399 a month. And Buick Enclave, $489 a month. Plus, every new Buick 24-month lease includes all maintenance and premium services. Experience Buick today with no money down and no worries. Shop 24/7 at dicknorris.com or visit us today. It's GMC Truck Month at Dick Norris. Save thousands on GMC trucks. Like 2012 GMC Sierra from $19,995. 2012 G95. 2012 GMC Terrain, $24,995. Or 2012 GMC Acadia, now $39,995. Plus, get 0% for 72 months. And up to $2,000 bonus cash on Sierra regular cabs, extended cabs, and crew cabs. Shop 24/7 at dicknorris.com. Save thousands on GMC trucks at Dick Norris.
Did you know 70% of all accidents in the home occur in the bathroom? Every day, there is a fatal accident from using the bathtub or shower. Here's how a Safe Step walk-in tub can help keep this a safe place that can actually make your whole life a lot better. A Safe Step walk-in tub means independence for people with limited mobility. They also offer incredible therapeutic relief for all kinds of aches, pains, and stress. A Safe Step walk-in tub comes with more standard features than any other tubs, including carefully engineered dual hydro massage jets that are specially targeted to sore muscles and joints in your legs and lower back. Safety never felt so good with the built-in support bar and the safer, less than 4-inch step-up, so you'll barely have to lift your feet to get in. They're made right here in the USA. Installation is included, and they come with a lifetime warranty. So take your first step toward feeling great and stay in the home you love. Call 1-877-496-6066 now for more information and to learn about their senior citizen discounts. That's 1-877-496-6066.
In the May issue of Senior Voice America, you can find out the truth about annuities. There is information on skin tips for men and women, and a great article about what's on your bucket list. Find out about why a cheap will can cost a fortune. Plus, you'll enjoy their regular features like Moffitt Cancer Answers, Senior to Senior, and the Entertainment and Happenings calendars. Pick up your free copy today at all Winn-Dixie stores from Sarasota to Pasco County and at CVS pharmacies in Sarasota, Hillsborough, and Pasco counties. Plus, stop by any 7-Eleven in Pinellas and Manatee counties for the current issue of Senior Voice America.
You haven't come this far to let sagging skin bring you down. Defy your age and your wrinkles with Image Lift's no downtime or minimally invasive procedures. Image Lift's board-certified facial plastic surgeons are artists. Having completed more than 5,000 facial cosmetic procedures, Image Lift can literally transform your life. This is your year to defy age. Dial 800-893-2237 for a free consultation or visit imagelift.com to register for one of our free seminars. That's 800-893-2237. Image Lift. The art of looking younger.
You're listening to Senior Voice America on 1250 WHNZ WHNZ. Here's your host, Evan Gold.
Well, we're talking hip problems today. We've got Dr. Matthew Austin with us from the Philly area, and he's an orthopedic surgeon. Dr. Austin, I've got a question for you a little bit, in the hip area here. Like when I'm running, I'm feeling like hip pain and, just having a hard time, getting them moving as easily as it used to be. And I'm 48 years old. Is that somewhat normal, or what do you think?
Well, it is somewhat normal, especially as you get older. I crossed over the 40-year-old threshold myself, and I'm finding it harder to keep up the same pace and the same mileage as I did when I was, say, 30 years old. So it is normal to some extent, but when it starts inhibiting your quality of life, and your ability to do things, at that point it's probably wise to see a doctor just to at least get a diagnosis and know what's going on.
Okay. And do you find that people that have been very active when they've been younger, like I was a tennis and a football player, you find those people, do they tend to have problems later on with their hips, bones, back, those types of things a lot more prevalent than people that maybe weren't as active? Maybe they were healthy, but they weren't as, physically active and more of like you got your body beat up.
Right. So there's a lot we don't understand about arthritis. Some people seem to do very little and get bad arthritis. Some people tend to be very active and never get arthritis. The key question is, has there been any damage to the joint, true damage to the joint? You had that cartilage that covers the end of the bone break down or get injured in some way. We know that when you have had that type of injury to the cartilage, that you are more susceptible to getting arthritis. So it's not just the activity, it's the type of damage that's been to the cartilage over time. If you've had previous surgeries, such as if you get a scope in your knee to clean up the cushion pattern of meniscus, we know that increases the force in the knee and can lead to arthritis in the future. So there's multiple variables that go into it.
So I got that to look forward to in both of my knees, you're telling me.
Not necessarily. Maybe you'll be one of the lucky ones.
I'll be one of the lucky ones. I would have rather you have said, maybe you'll be one of the hundreds of thousands of lucky ones. but
I can say that if you want.
All right. Well, but Dr. Austin, so now going back to the hip fractures, the replacements, talk about them. There's like a fix-it with rods and plates. How does it work? Did we lose Dr. Austin? Okay, you're going to try to get him back real quick? Okay, Steve's going to try to get him back real quick. But it's true, you get all these problems, you get beat up. My generation, I think, back in the 70s were really the people that were really playing sports. That was the beginning. You'd say the 60s to some extent, but the 70s, I grew up in Miami. I played football, basketball, soccer. What a horrible sport that is, 0-0. Who's got the time for that,
And how can you say that, though? Do you think the people that played sports in the 60s or the 80s did not feel like they were really, really athletes then playing
No, I'm not saying the 80s. I said it really started big in the 70s, and it continued through that time. But we've got Dr. Austin back here. So talk about the repairs for hip replacements.
So when someone has a hip fracture and the bone ends are separated, like I was talking about earlier, in general, we replace those if those are in the neck portion of the femur. Now, sometimes if the fracture is a little lower on the femur, we can use plates and screws to fix it, even if it's displaced. So it's really up to the It's really up to the fracture pattern and the expertise of the orthopedic surgeon to help you determine what the best treatment is for that type of fracture.
And if you're picking out an orthopedic surgeon for that, is that the time to find someone that's an expert in that specific mode of treatment? That's their business. Hips, that's what they do. What's your thoughts there?
It is in general. Better to find someone who's comfortable fixing these type of fractures. Now, sometimes when you break your hip, you don't get all that much of a choice. It's not something that you can sort of wait to get fixed because there's an increased risk of problems after the surgery if you wait too long.
Okay.
So sometimes you don't have a lot of choice, but sometimes you do. If you have hip arthritis and not a fracture, then you do have time, obviously, to go and search and find the best doctors for you. And you want to find someone who's comfortable, who does at least a significant volume of hip replacements in order to minimize the chance of complications.
And so what's life like after hip fracture and getting it repaired?
Well, it can be a slow recovery. A lot of patients who have hip fractures are a little bit older, and it takes you longer to recover from an injury. It can be frustrating, especially for the first few months. And when patients express their frustration, I often tell them, hey, look, Chase Utley is a very popular baseball player in our area. He had some problems with his knees, and he's a professional athlete, and he's 30-something years old, and it takes him a long time to recover. Typically, patients are 75, 80 years old. It's not going to happen any faster for you. So
Right.
You have to temper their expectations and just let them know that you can get back to doing the things you want to do. It just may take you a little longer than you want.
For the younger crowd that might get a hip replacement, it might not take as long, but can you get back to where you were to some extent? I mean, how much function are you getting back in your life?
Well, it depends on where you were. If you were doing Ironman triathlons, you're probably not going to get back to that. But if you were doing activities like doubles tennis or skiing just on groomed trails, we generally say that's okay. But for each patient, it's different, and for each patient, I urge them to talk to their orthopedic surgeon about what activities are wise and what activities aren't so wise.
So you have to be realistic. If you're in your 50s and you get hip replacement, you might not be back on the double diamond runs, but you could still ski, you know?
Yes, I let my patients ski.
Okay. So, so where are some good sources of information for patients?
Well, there are a couple of good sources of information. You have to be very, very careful when you're on the internet, because as you know, there's a lot of misinformation out there.
Yep.
And so for patients, they need to go to reliable sources, and there's a couple. Both are put up by the American Academy of Orthopedic Surgeons. They're meant to be not biased in any way and just provide information to patients that's reliable and they can depend upon. So the one site is called A Nation in Motion. That's all one run-on word sentence, anationinmotion.org, O-R-G, or orthoinfo.org, which may be the easier one to remember. So it's orthoinfo.org.
And then that will cover